So our research has shown us that people with developmental disabilities are more likely to go to the hospitals for emergencies than people without developmental disabilities. But we've also learned that they're more likely to have repeat visits. DD Cares is a program that we worked on to try to figure out how we can improve emergency department visits for people with developmental disabilities, and also how we can improve what happens after those visits. A big part of this project was working closely with all the different types of staff at the hospital to figure out what the barriers to care are when supporting people with developmental disabilities, and to figure out how we can work to implement changes given the structure and how this particular hospital works. So it's difficult to set up a process that works for every hospital because the staffing at each hospital is different, the population that the hospitals serve can be different, and the infrastructures are quite unique. There are three main pieces to our intervention. The first focus is really looking at what information is coming in about patients with developmental disabilities, so that when the staff at the hospital are doing their assessment and trying to figure out how to best treat the patients, they have the best information available to them.
We do a better job in the emergency department when we have more information, right? So for patients who've got specific needs related to their developmental disabilities, it's really important to know that. When patients arrive with a package that says that these certain techniques, these certain ways of interacting with the patient work well when they're afraid, right? Any complicated patient population having more information specific to their needs will help us do a better job of meeting those needs.
The second part of our intervention really focuses on those linkages to services that exist in the community.
Understanding that's a team sport. We can't do everything in the emerge, and we have learned to work with different partners and communities, and this is a new type of patient population that we're learning to better interact with the service that they have available.
So we needed to figure out how to share information that's useful with hospitals that they can access quickly to remind them of what resources are out there. And then the third focus of our intervention has looked at what happens when the patient leaves the hospital.
When the client is in the hospital, that there are great opportunities to work with a community team and bridge that gap between what needs to be done to keep the client safe, both in the hospital and in the community.
We really need to develop a type of package or system so we can get the information about why the patient was there, what we did, what needs follow-up, and get that information to the community support services, to the caregivers, to the families, and to the primary care people who were involved in this patient's care.
The underlying issue is really listening and being open to collaborating with both sides, the community as well as in the hospital.